Hello, everyone. Thank you so much for coming. You are watching Brown Girl Bella. I'm your girl, Shannon B. And as always, bringing you lips, lashes, and luxury. Today is episode 3 of our Boss Bella series. And I got a boss for you, honey, today. This is Dr. Pascale M. White, MD. I'm going to give you a little bit about her and her background as her bio, but then I'm going to let her jump in and talk the way she wants to be introduced. So without further delay, let me give you a little background on our doctor here. Dr. Pascale White is an assistant professor in the Department of Medicine, Division of Gastroenterology, and the director of the Gastroenterology Clinic. She received her medical degree from the George Washington University School of Medicine and Health Sciences in Washington, D.C. She completed her internal medicine training at New York University, School of Medicine, where she was also chief resident. She completed her fellowship in gastroenterology at Memorial Sloan Kettering Cancer Center. She has published many articles on colorectal, am I saying that right? Mm-hmm. Okay, great, cancer screening, and has a strong interest in health disparity research. She is involved in the education of medical students, residents, and fellows. She's a member of the American College of Gastroenterology, the American Gastroenterological Association, and the New York Society of Gastrointestinal Endoscopy. She is a board certified doctor in internal medicine and gastroenterology. Without further delay, give it up and let's welcome in our fan girl, Dr. Pascale.
Thank you. Thank you for having me. This is so much fun.
Thank you. So just a little, preamble about Boss Bellas. I've had a lot of people on. And we'll have, quite a few more people on in the coming months. And so the first 2 that were on the show were actually sorority sisters of mine. So let me lay the playing field. She is not a sorority sister. However, she is family. And I was like, she's a boss. She needs to be on here. She needs to educate people about what she's doing and how she got into medicine and what her background is like and her rise to fame, because she is somebody to watch. So Dr. White, let them know what's going on with you.
You are too kind. First and foremost, thank you so much for having me. I have been looking at your success with this Brown Girl Bella site, and I am just so incredibly proud to call you my friend and family. So thank you for giving me this opportunity to come and address your audience members. For me, for medicine was always something I wanted to do. I was 5 years old, and the stories you always hear, right? You saw someone sick in your family and you wanted to help them, but it was true. Like, I saw someone sick in my family. My grandmother was sick, and I always had questions and questions and questions. And my dad was like, all right, you have a lot of questions. Here's this book. Okay. You go read the science book and, you're going to have all your questions answered. And since I was 5, I really just wanted to help people. And it kind of grew into honestly wanting to help my community. And that's where the health disparities comes in. That's where looking at things that affect Black women, Black men come into my profession, and trying to push the word out that there are some things that we can do to help ourselves, to keep ourselves healthy, to keep ourselves to preventing disease. And so, that's where my passion lies, in really prevention and just kind of getting the word out there and helping my community.
Awesome. So since you kind of grew up always wanting to be a doctor, explain for someone who may want to, follow in your footsteps, like what are the steps to becoming a doctor? What do they have to do right now should they want to go into that field?
So that's exact question I asked my dad when I was 8. And I literally drew the steps for me to become a doctor. And I had it on my wall for at least 10 years. And then we moved out of the house. So I don't even know where that thing is. But basically, you go to college for 4 years and you can major in biology or you can major in whatever you'd like, but at least you take those pre-med courses, right?
Okay.
Then you apply for medical school. Before you apply, you have to take a test to get into medical school, an entrance exam. Medical school is 4 years. Some schools are 3, depending on how fast you want to do it. And after medical school, you graduate, you are an official MD, but you need to have specific training in what you want to do. So some people go to surgery, some people go into internal medicine like I did. And so I went to a residency program that teaches me how to be an internal medicine doctor. And from there, I said, okay, I like general medicine, but I really want to focus on one aspect of the body, and that's the GI tract, everything from your mouth all the way down to your bottom. So that's what I wanted to do. I wanted to focus on diseases of the GI tract, stomach disease, colon cancer, pancreas, liver, stomach stuff, and people with gas and bloating. This is what I want to do. Mm-hmm. So I had to go through what we call a fellowship, which you said was Memorial Sloan Kettering Cancer Center. Mm-hmm. So that fellowship is 3 years where I learned how to perform specific procedures helping people in their GI tract. That includes colonoscopy, going through the bottom, or an endoscopy going through the mouth, looking into the stomach to see why people are having trouble with, stomach pain or gas and bloating. Mm-hmm. So all together, if you count 4 years of 4 years of undergrad, 4 years of medical school, that's 8. 3 years of medicine, but I also was a chief, so that was an extra year. It's kind of like they pick people who are at the top of their class, so that was another 4 years. So that's 12. And then I went for fellowship, which is another 3, so that is 15.
Oh my goodness.
And then I'm a grown-up. So now I've been out of fellowship and practicing gastroenterology as an attending gastroenterologist for the 3 years. So.
Wow. Crystal Christine, who is in our chat, says, we have the same passion. I'm a nurse, LPN, to be exact, going back for my RN. Yes.
Rats. Yes. I work with a big team of people. I could not do it without my nurses. I could not do it without my physician assistants. So I'm a very, very big champion of teamwork in medicine. So I can't do things without my nurses and vice versa. I work closely with my techs, especially during my procedures. They know what I like. They know what tools I like to use. And so it's a team effort. I congratulate you for going into medicine and, going for your RN. Congratulations.
Yes. That is incredible news. And good luck to you, Crystal. So explain to me, because you mentioned internal medicine quite a few times. Yeah. What is that specifically, and how is that different from like a general doctor, or is that a general doctor?
Yeah, so internal medicine is essentially your general doctor, meaning the doctor who you can go to for your primary care. And these are terms that people use because there's different tracks. So people who do, let's say, primary care are your primary physician who usually go through training as like outpatient people. Like they see a lot of people in the clinic, and their form of training is a little bit different versus an internal medicine doctor who does both clinic or office work and in-house or inpatient work. So there was a lot of training in the ICUs to kind of get to know the general body from top to bottom.
Right.
So people who want to do general practice, who want to see adults, they call themselves either internal medicine doctors or primary care doctors. That's essentially interchangeable to anyone in a layperson or audience person. If you wanted to say, hey, I like learning about general stuff, but I really like the heart, then you would do a cardiology fellowship, or that's a cardiologist who just looks at your heart, or a gastroenterologist who just looks at your gut, who only focuses on that. And if you have any issues with, let's say, diabetes or your cholesterol, you go see your internal doctor or your primary care doctor. So that's kind of like the difference. So I could have stopped and said, I don't want to specialize. I just want to see general problems. And that would have been completely fine. Mm-hmm. I wanted to specialize. So I had to go through that extra special training to learn a little bit deeper about the diseases I'm going to treat.
Wonderful. Thank you so much for clearing that up. So I just went to my internal medicine doctor, and they say that as well, like she's going to be my primary care doctor, and I'm like, oh, okay. So it's good to know that that's what that is.
And they're your point person. They're your point person. So whatever problems you have, go to your primary doctor because they're the ones that are following you for the longest period of time. So especially like me, who let's say screens you for colon cancer, I'll see you once or twice, but if you don't have a GI problem, you go back to your primary doctor who's going to follow you all through your adult life. Much like a pediatrician who only sees kids up until they're 18, they follow the kids from birth all the way till they're 18. But if they have like a specific problem or genetic problem, they'll send them to the specialist. So that's where the referral comes in, right? So they refer you to a specialist, but you always belong to that primary care doctor as their patient.
Okay. So yeah, so they just told me I need a colon screening. So
okay, let's talk about it.
I just made that appointment.
How are you feeling? Like, let's talk about this for real. Like, how are you feeling when you heard that? What was the first thing that went through your mind? Was like, so it's fear. All right. Were you embarrassed?
I wasn't embarrassed because it was just him and I in the room. But for him to say, well, you know, you're at this age where you need to. What do you mean? I'm at this age, bro. Well, it can't be true.
First of all, he just saved your life because even recommending colon cancer screening to the Black population, they're 6 times more likely to get screened than anybody else. So just having that recommendation, you are already out the gate in great hands, because one of the barriers to screening that I found during my research was that physicians are not recommending screening to their patients, and we don't know why. So you have a good one.
Yes. And that was actually the physician's assistant. I haven't seen my main doctor yet. He just gave me the physical. But what I loved a lot about his approach, though, was the fact that he was like, listen, the fact of the matter is you African Americans, Hispanics, and Asians, all different types of tracts to form there. So if you're Hispanic or African American, you have to focus on the heart, making sure your cholesterol is down, making sure your sugar levels are normal. And if there's any fluctuation in that, additional tests may be needed, or, you know, diet and exercise may be the approach that the doctor would take. But if you are Asian, there's a whole different slew of things that you have to worry about that we're not, that doesn't affect us in the same way because we don't have the same diet.
So they call risk factors, basically. Like he was basically explaining to you that based on your race or ethnicity, you can have certain risk factors for certain diseases. Right. And so just kind of highlighting that for you or for an African American, you know, woman or man, getting screened for colon cancer is a priority because Black people are more likely to get diagnosed at a later stage. They're less likely to survive. And so with all of that, you having your patient know that just by virtue of their race, that's a risk factor. Getting a preventable disease is something that, you know, I champion for all primary care doctors to do. Tell your Black patients about getting screened.
Exactly. Vern said, nope, I'm not doing that.
Please tell me why. Because this is part of what my research is, right? Knowing what are the barriers, what are people afraid of in terms of getting screened, which means getting a test to look for early forming growths.
Right.
If removed, will never form into cancer.
Absolutely. I think what the fear is, because I see another note saying, nope, no approach, homie. I do not drop the soap. Well, so I learned, which go ahead, doctor, because you're
I want to address this in real time. Okay, in real time. So there are other ways to get screened for colon cancer. People who don't want to be, you can get a stool test. You can literally do it at home every year for one test or every 3 years for another test. So I don't want to hear about not dropping the soap. I won't even do that. We're going to send you a stool test. You're going to put a little bit of that stool in that kit, and you're going to send it off to your doctor. And if there is blood in the stool, my hope is, and it will have to be, that then you will be intrigued enough to say, I have blood in the stool. But the first step is getting an actual test. So you can do the colonoscopy, but you can also do stool tests too. So I didn't want to miss that opportunity to
No, that's why I'm looking in the chat to see if there's any other things.
What are they saying? I can't even see this chat.
Oh my God. Okay, let me finish reading this chat. Okay, it's moving a little fast, so I want to make sure I got everyone. Thank you all for coming. Crystal Christine said blood pressure as well. Yes, check your blood pressure. For the first time in forever, my blood pressure was a little high. So much so that they had to take it again. And I was like, really? Because I'm usually the opposite. I'm usually low or normal.
Okay.
For them to tell me I had high, I was like, "Oh, what's going on?" And he said it might be anxiety because of, you know, what we're going through with the quarantine. You know, you could have been rushing to get here. There's all sorts of factors. You'd be nervous about, you know, the fact that you got to do this physical. He was like, so that's why we take it again at the end so that we can see, you know, if there's something really there that we might need to take note of, or if it's just, you know, what they said, just nerves.
Yeah.
So yeah, and luckily the second time it was normal.
They call it white coat. Sometimes people can, you know, have, again, anxieties, that things on their mind, and rushing into the doctor's office. And so whenever I see blood pressure that's really high, I just let my nurses know, hey, can you just recheck it at the end of the visit when the patient's more relaxed, and, you know, kind of make sure that they're okay.
Absolutely. Mickey's in the house. She's saying good evening and thanks for the forum, Dr. White. Buddha says, I understand health-wise it's recommended, but I know my body.
What is your body telling you?
Yes, that's what we need to know, Buddha.
What's your body telling you?
All right. I see a lot of hellos in the chat. Hey, Topi. Topi's in the house. Utopia Worley. Welcome in. Absolutely. She says, I really love this forum. We need more information like this from Utopia Worley. So yeah, we definitely do. I think for me personally, when I hear stories about people going to the doctor, it's usually as a corrective measure and not as a preventative one. And you really need to start looking at your body and saying, you know, I know a lot of people say, well, I know if something's off because it'll be off of my body. By the time it gets to that point where you know something is off, it might be too late.
Yes.
So it's always important to go and get a full checkup, have them check your stool, have them, you know, check your mouth, check your ears, check your body for signs of mold, like really go in and have these things done. Because once you discover our problem, once you discover that there's something wrong, it's usually, you know, further along where, you know, now you're going to get symptoms from it.
That's right. So the screening, so people don't really understand what it means to be screened for stuff, or screening for cervical cancer, or screening for breast cancer. Screening means that you are getting checked out and you do not have any symptoms. You are healthy, you are fine, you are feeling great, you know your body's feeling great. That's a screening, meaning they're going to look at you from top to bottom to see if there's anything hiding in there that you're not feeling yet. Once you start having symptoms, it's called diagnostic or diagnosing, right? So I would give you a diagnostic colonoscopy if you have blood in the stool. Why? Because I'm trying to diagnose why you have blood in the stool. Versus I'm screening you for colon cancer. I am basically looking for things that will hopefully never have you get colon cancer and taking it out of your body. And unfortunately, some people do develop or do form very advanced growths in their colon without any symptoms. I just screened a 49-year-old man, true story, black man, feeling fine. Came in, doc, got to get screened, great. I looked into his colon and I saw a very, it's hard to describe. It's like a little bit of an ulcer. It just looked like, why is there an ulcer here? I don't understand it. Let me just take a sample. I took a sample of it. It came back as a polyp, which is an abnormal growth. I sent it to my partner because I wanted my partner to completely remove it for me because it was pretty large area. And it came back as early cancer. So we have to send him to surgery.
Oh my goodness.
In one sense, you can say, oh my God. One, I'm thinking, oh my God, like what if I didn't see the ulcer? I mean, I saw the ulcer. Right. Oh my God, what if I didn't see it? Right? And I said, come back in 10 years. And God forbid, it would have developed something late. But I did find it. He did come in. We did find it early. And he is fine. He's going to have surgery. He's going to be cured. I have 86-year-old women who I found cancer in, got surgery, and she's coming back for her third colonoscopy for me to check out and make sure everything's okay. She's still alive. She's going to be 90 soon. So for me, it's more like, I know you know your body. I know people feel great. But don't wait until you don't feel great to go to the doctor. That's when we're trying to play, Monday night quarterbacking. Like we're just trying to figure out and try to catch up. You play ahead of it. You don't want to play catch up. So
absolutely. Absolutely. Okay. So the thing I keep seeing most in the chat is the actual scope going in.
Okay.
So explain to them what happens when you go in for your colonoscopy.
So first and foremost, it's the best sleep of your life. So I hear, haven't had one yet, but I hear it's the best sleep of your life. So you'll be asleep, you'll be comfortable, there will be no pain. I go in with the camera, that's the size of my pinky, but it's attached to a tube. And from there, I insert it through the bottom. Okay, I lube it up so there's no trauma, there's no pain, and you're asleep anyway. And so go in through the bottom and go all the way around. And I'm taking my time to look at every corner. Like, you ever see the race car games where you turning corners like this?
Yes.
Well, no colon is straight. So I'm going in, I'm looking at every corner. I'm looking up, I'm looking down, I'm looking around. I'm looking at the texture. Does it change? Is it smooth? Is it rough? Am I taking samples? And I'm looking for things that could potentially cause you to have cancer 10 years down the line. The entire procedure takes about 30 minutes to an hour, depending on what I find, depending on how many polyps you have. And then from there, after I'm done, you may not have to come back for another 10 years if I didn't find anything. Or if I found some polyps, you may come back in 1, 3, or 5, 7 years, depending on what the lab tells me. So the actual insertion of the instrument, you will never feel. You will come into my room and you will see my instruments laid out, very sterilized and clean. And then I say, have a nice nap. And that's the last thing you hear until I say, how do you feel? And when you're done. And obviously, Will Smith had documented how he did his colonoscopy. There are other people, celebrities who documented it. So they can attest to the fact that it's quick, it's safe, it's effective. And once you have the relief that there's nothing in my colon at this point, you can sleep better knowing that you took care of yourself.
Exactly.
The actual instrument's not long. It's about like 8 to 10 millimeters in diameter. So it's not big.
Yeah. I think, excuse me, I think my doctor who talked about it with me said that the tampon was actually bigger than the scope.
It is. Yes. It is. It really is. It really is. I mean, the worst part of the whole thing is when you take the laxative. So people have to really clean out.
Right. He said that's not pleasant. Right. That's not pleasant.
Doesn't taste good. No.
But I've had that before because unfortunately I had to have my gallbladder removed. So I had to take that before as well. But yeah, so note, ladies, not that large.
No.
Too. It's not that large.
It's really not. It's really not large.
All right, let's check and see what people are saying as well.
I think I see a question from Dolores White. Hi, Mom. That's a good question.
Let's see. Where is she?
Towards
Wait, Crystal said, I had children and been violated in so many ways. So go ahead and check me over. There you go. You can have test kits for colon cancer sent to you. That's right, D.O.D.
Yes.
Okay, so yeah, we said, something's gonna get stuck in you, but
I'm proud of you.
Small. All right, heading downwards, see what else. I will give the stool no problem. Okay, do that. Do that. See, we changed one person. We changed one person's mind. Yes, I'm not aware. Okay, we got 2 people. Burns was another one that said she didn't want to do it. But as in anything else, no, thank you. God forbid they say we need a second test, but we need to know the options. Okay, no problem. Hi, Infused World. Welcome in. Welcome in. We've got Dr. Pascale White here talking about medicine and preventative care. We have more people saying hello.
Hey, guys.
Okay, here's a question from D.O.D. What are some of the signs of colon cancer?
So first and foremost, you are your best judge, right? So the first thing that we always say is you have a baseline. So I may have and go to the bathroom, let's say every day, where someone may go to the bathroom every 3 days, and that's them and they're fine. Any change in your normal routine, meaning you're more constipated than usual, meaning you're going less frequently, or you're having more runny stool or diarrhea more frequently, that could be a sign we call change in bowel habits. And so that's one sign where things are just off your baseline. Two is obviously bleeding. So we're finding that there are a lot of people who are coming in who are less than 50 years old who have colon cancer. And we call that early onset colon cancer, where they're having signs and they're having a little bit of bleeding. And they're like, oh, that's hemorrhoids. Oh, it's nothing. And then it's something. So if you're having any bleeding, it's not normal. Even if it's from a cause that doesn't cause cancer like hemorrhoids, it's still not normal to bleed. Do you know what I mean? So you have to find out why you're bleeding, whether it's something that's completely, not cancerous or cancerous. So bleeding is nothing. Weight loss. If you're not trying to lose weight, and I know everyone's trying to lose weight, but if you're dropping weight and you're not really trying to drop weight, like you're just kind of melting off, that's another sign too, right? Because we know that cancer can steal those nutrients from your body and essentially metabolize in a way where you're just it's just using up your nutrients. So you're going to be losing weight and you're not knowing why. So weight loss, rectal bleeding, change in bowel habits, abdominal pain. It's very non-specific, right? We're not talking about you going out to eat and you're having pain. We're talking about like a prolonged month, 2 months, weeks worth of just not feeling right. Things are just painful. That could be another sign too. So along with that, and taking into account your medical history, your medical background, your family history. So I know Thanksgiving's coming up, your holidays are coming up. Talk to your older family members about what do they have. I know especially in the Black community, we're not talking to each other. We're not asking grandma what she had the surgery for. So like you need to know what cancers run in your family, because you may need to get screened for cancers very early. So if your family member, if your mom or your dad, your sister, brother, your kid had colon cancer at 45, you are going to have to get screened at 35. So all of these things come into play when you talk to someone like me, and I can kind of lay it out for you. Like, this is your risk factors. This is what I'm finding. This is what we have to do.
Absolutely. Great question, D.O.D. Thank you.
Very good question.
So Buddha just asked, what is the age required to check?
So we say now 45 is the new 50. So it has always been for a while now, since about 2009, that society recommended 45 years old for Black people, and 50 for everyone else. That shift came in 2018, where that early onset colon cancer was creeping in, where people in their 20s, 30s, and 40s were getting rectal cancers, and people were like, why are they getting cancer so early? So they switched it down to 45. And just last week, another society said, yeah, we have to start at 45, not 50. So for everyone here, it should be 45 years old that you should get screened for colon cancer.
All right. You heard it from the doc. 45. Let's go. Buddha says, oh my God. We're supposed to know what kind of sleep, full sleep or twilight sleep.
Okay, so you are out, but you're not fully out. So that means that it's a fast on and fast off. And depending on who the anesthesiologist is, or the person who's giving you the medicine, they may use different medications. So twilight would be a couple of different combinations. You're awake, but you're groggy. What I use in my practice is you're completely asleep, but once we turn off the medicine, you're up in 2 minutes. So you're asleep, but you're not like, you don't have a tube in your throat. You're not on a machine, you're not breathing on a machine. It really is what we call just, moderate sedation, where you're sleeping comfortable, but we can wake you up in minutes if we need to.
Okay. And is that done intravenous way or?
Right, yep, it's done. So you will get an IV, and they will put the medication through the IV so that you'll fall asleep.
Okay. Okay. Good to know.
Great questions.
Yes. Crystal says diarrhea, constipation, bleeding, pain, gas are all signs of colon cancer. Yep.
It's prolonged, and if it's a change for you. So some people may have IBS or irritable bowel syndrome and they have diarrhea. Just make sure you get that checked and make sure that it's actually irritable bowel syndrome and not something else.
Oh, Vern said, Dr. White, can you do mine then? I feel comfortable with you already.
Come to my office.
Vern, she's in New York.
Yeah.
So, yeah, we can make your appointment.
Absolutely.
Yep, Dolores White said, what are the signs if you already have colon cancer?
So if you already have colon cancer and if you were, let's say, treated, obviously they're going to follow you in terms of your CAT scans. They'll follow your blood work to see if there's certain levels that are elevated. If you already have the colon cancer, and you don't know it yet, it's all the signs that we just discussed. Rectal bleeding, your stool looks different. Like if your stool used to look normal and formed and now it's looking thin and stringy, or you're not going as much, or you're going too much. These are all the signs that you may have colon cancer, and you have to get checked out to rule it out. And the only way, really, honestly, you can do that is with colonoscopy. So once you have these signs, you can't say, oh, give me a stool test. No. Once you have the signs, that's what I said. It's a diagnosis now. The diagnosis that has to be made is through colonoscopy. If you have no symptoms, then you can get the stool test just to check to see if there's microscopic blood that you didn't see with your own eyes that's lingering in your stool.
There you go. Good stuff.
Yes.
All right, hang on a second. Let me make sure I got everybody. Oh, she's way up. No, yeah, she might be. Well, she's in New York City. She's in.
Right. I practice in Manhattan. So if you put my name in Google search, you'll see exactly where I work, and then you can call my office and make an appointment.
Awesome. Mickey Dixon says, "What's a home remedy for keeping your GI tract clean?"
So your GI tract is not meant to be clean. Right. So GI tract, your colon lining needs bacteria in order to stay healthy. Mm-hmm. It's when there's lack of bacteria where we call it like your microbiome is off balance, is when you get a lot of different types of diseases. So GI tract not meant to be clean. What's a healthy regimen to keep you regular, depending on your background and what you eat? Increase your fiber intake to make sure that you are getting and bulking up your stool. But there's nothing to clean your GI tract. It's a very dirty place, but for a reason. Like that was made to keep it dirty with bacteria to keep the lining of your cells healthy.
Okay. So what do you think about all of these different cleansing and cleansers that people are taking right now? It seems to be all the rage. What do you think about that?
I don't.
All right.
I don't. Honestly, really honestly, all of these things are not FDA approved, right? So every bottle could be different. They could be filling it with different stuff. A lot of these things that are not FDA approved can hurt in terms of like potential having liver problems or liver disease. So, I don't think about it. I don't. And I really caution people to think about what they're putting in their body, because the intended result may not be what happens.
Okay. Buddha says she drinks apple cider vinegar 3 times a day, like a shot.
I don't advise that either. Because the apple cider vinegar itself can cause a lot of inflammation of the stomach called gastritis. And so a lot of people who come to me with different stomach problems or different stomach pain, and they don't know why they're having these issues. What happens is that I say, well, what are you drinking? What are you eating? And sometimes that can cause effects on your stomach that may not be completely okay. So I don't advise or I don't prescribe apple cider vinegar to people. I don't encourage it, but obviously, the data is still out in regards to how does it actually affect in a good way, your body.
Perfect. Yeah. Vern said, I don't like the tube. I felt they stir up stuff or break up the stomach barrier.
The tube? What tube?
Yeah. I guess the tube that you use or the scope that you use, she said she felt that they stir stuff up or break the stomach barrier.
No, not at all. And the stomach is not, the stomach is distensible, right? That's the only way that we can actually eat. Our stomach is made for it to distend, for it to expand, to receive the food. And the scope itself or the instrument is like this tiny in diameter. So it's like you're swallowing it and we're going into like a big space where the stomach is, and we're taking a look, just kind of looking around in the camera. But it's not breaking up anything. A matter of fact, if the only way it would do that is if we kind of take a biopsy because we're looking for bacteria in the stomach, or we're looking to diagnose why you have an ulcer, things like that.
Okay. Utopia Worley says, Dr. White, you are awesome.
So
family, welcome in. Thank you so much for coming. Guys, don't forget to hit that thumbs up button. And please share this stream out. Hit that share button. Desiree White says, great points, really great points regarding family history. Thank you.
Thank you, Des.
Buddha says, okay, that's 3 years left.
You do, unless you have a family history. So you got to find that out first, and then we'll calculate back how many years you have left.
Okay, so Dolores White has a question. Can you come alone for the test?
You can't come alone. Okay, caveat. You can come alone, but someone has to come get you, because we're going to give you anesthesia. We'll give you a little bit of sleepy medicine. So we need you to have an escort to pick you up so that you can leave our endoscopy suite safely. But coming there before the procedure, yeah, of course you can come alone. And no one is going to be in the room with you except myself and my team. So you'll feel very safe, very secure. I play great music in my suite, just letting you know. But an escort will have to come and get you.
Okay. Awesome. Thank you so much for that. That's right. Binge watch. Get bellified. Hey, Sugar, welcome to the live stream. Thank you so much for coming.
Yes.
D.O.D says, I have achalasia for 20 years now, and I get scoped every 3 months. Do you have any special training in that field?
I don't. I have a lot of partners who do achalasia treatment, and so achalasia is a disease of the esophagus where there is essentially what we call a bird's beak. It looks like as if it's too tight and nothing can get through it when you swallow, and you have problems with swallowing solid food. Sometimes you can have chest pain if food kind of sits there, and it causes like inflammation in the lining of the esophagus. So yeah, I don't have special training in achalasia, but I have great partners at my practice who do. So
awesome. Thank you for that. Krista says, don't do it often.
Which one?
I don't know. Living your best life. Hello. Thank you so much for coming. Guys, don't forget to thumbs up this live. And if you can, share us out. Toby says, again, thank you so much for this information. Everybody's welcoming people in. My Maz are welcoming people in. Maz, if you see a question in the chat that I did not see, for some reason I went scrolling through, but if you see a question, just give me the heads up. Thanks. Now, I know we had a couple of questions that came in beforehand, so I want to make sure we address those while we can. So do you think that there is, before I begin, if you have a question related to her field of specialty, so she doesn't do like, I think we talked about maybe lupus and MS and those types of things, that's not her specialty, but anything, involving the stomach or the gut, she would be able to help us with that. Okay, so with that, we're going to take this question. Do you think that there's a difference between drugstore makeup? Oh, this is makeup question. Oh, we're going to makeup. Do you think that there's a difference between drugstore makeup and celebrity makeup? I guess high-end makeup. What do you think about that?
I mean, I'm always in Dwayne Reed looking around and trying to see if I could find something that's my shade. And I think I was initially turned off by it because I couldn't find anything that looked like me. So I always gravitated towards department stores and makeup there because I felt like it had more options. But now with the advent of different shades coming out with Fenty and different stuff, other people feel the pressure and competition to try to get themselves out there. So I can't speak personally as to the difference, but I think that I would be willing to try if there were just more options for my shade or my skin type. And I have very oily skin, so I have to find something that really mats it down and smooths it out. If they had something like that, I wouldn't be adverse to trying it. Like, if it works, it works.
Absolutely. Now, remember, guys, it's important to note that makeup is a free-flowing thing. So nobody's discovered anything new. It's just varying variations of the same thing. So when you see the drugstore foundations, a lot of times they're taking that cue from other companies and other places, and they're just making it more affordable for you. So they're going to have some of the same ingredients, but not all. That's the real difference between drugstore brands and higher end brands. They have the same ingredients, but the higher ends are able to add more products in it. So maybe, it has squalene in it, or some vitamin E, or maybe it has an SPF that the drugstores may not be able to have that ingredient because then it will cost too much. Right. So that's the real difference. And why I chose luxury is because, one, the mid-tier and the higher end, the higher you go, the more options that are available to you, unfortunately. The lower you go, actually, the lower options are available for you. So if you ever notice, like in your area, if there's not a predominance of people of color, then the drugstores that you would go to would have limited resources because they are saying, oh, no Black people live here, no Hispanics live here, no Indians live here, no Asians live around here. So we're going to go to where they are and put our products there.
Yeah.
But if I live in a predominantly white area, I go to my local CVS or my local Walgreens. There's nothing in my skin tone. There's nothing available for me because they don't think I live here. So they think they don't have to do it. I mean, that's just the honest to God truth. And that's why I started going towards the high ends, because I'm like, I need a product that's going to be there for me. I need to know if I run out of this, I can go to X and get it. And that's why I made the switch to high end. We have another medical question in here. Is there anything that helps with bloating stomach besides probiotics? Ooh, that's a good question.
So I have to take it a step back and say, have you been worked up for bloating? So bloating is kind of like a scary thing to me. And the reason why is because it could be completely nothing, like gas, or it could be the ovarian cancer I diagnosed in a 41-year-old like 2 months ago. Like, it could just be anything. So when someone calls me about bloating, my ears are like, like,
perk up.
Have you looked at your lady parts? Is GYN involved? I'm going to get involved. I'm going to check you for bacteria in the stomach. I'm going to give you what we call a 24-hour diet recall. You have to tell me every single thing you ate for 24 hours and keep a food diary. Like, it is serious. Like, bloating scares me because it could be something, again, completely not, scary to something super scary. So probiotics themselves, there haven't been, there's only one probiotic, we call it Align, that has been studied in terms of people who have inflammatory bowel disease, like Crohn's disease, ulcerative colitis. But other than that, you can get probiotics by eating yogurt, right? Or you can investigate first and foremost if you have any lactose intolerance. So the first thing I always do is make sure that you're not having any other symptoms. Make sure you're looking at your diet, because it could just be something as easy as lactose, or it could be something as complicated as celiac disease or gluten autoimmune disease, or it could be something that is part of your GYN. And so probiotics is never part of the treatment for bloating. It's more like, let's figure out why you're bloating, and then probiotics may or may not help if you're having any other symptoms like diarrhea with it or something like that.
Okay, perfect. Thank you. Another question from Dolores is, are there different things to knock you out for the test? If so, what are they?
You mean like, okay, so most of the time people are using like what we call propofol. It's a medication that is administered by an anesthesiologist through your veins so that you can be asleep and comfortable.
Now, understand what she said right there, because I know a lot of people are going to jump to like the Michael Jacksons and the Princes who took this recreationally. Propofol is something that should be administered by a anesthesiologist, correct?
That's right. Anesthesiologist. That's it. Not a cardiologist. Certainly, obviously, there's certain gastroenterologists who do other stuff to keep you comfortable, but propofol is not one of them. We can use other things, but this propofol, anesthesia has to be there.
Absolutely.
Or you have what we call a certified nurse anesthetist, or CRNAs, or nurses who can anesthetize patients for procedures, but they're overseen by their attending anesthesiologist.
Here's a question I need to know too. What exercise can you do to shrink your stomach?
The exercise that you're doing in the kitchen, okay? This is not going to shrink this. And I learned that personally. So
exactly,
it's about what you're eating, what can increase your belly fat, and we can talk about, good sugars, bad sugars, white bread, wheat bread, whatever it is. It comes from, there's an adage that says abs are made in the kitchen. So there you go. Whatever you're eating into your body, it has to be less coming in and more going out in terms of exercise for that to happen.
Absolutely.
And strength training too. I do a lot of strength training and focusing on core muscle work. So doing planks, doing a lot of lifting has helped.
Yeah. And those are things that you can really do in the house. You don't have to go out to a gym. So, right now we're in this, quarantine for the foreseeable future. So everybody, just grab a exercise mat, order one on Amazon, get on that floor and start crunching. Nothing else to do. Stop crunching on the potato chips and start crunching.
That's right.
And Dr. Shannon, heal yourself. And I'm looking at my mat like, yeah, I ain't seen you in a couple of weeks. So I definitely need to do it myself as well. All right. So not to, move totally away from medicine, but remember, we have her here. So if you have a question that you want to ask, now is the time. I'm going to move the conversation into the other M word, which is marriage. Now, Dr. White, you are married, aren't you?
I am married. Yes, I'm married.
And how long have you been married?
10 years.
Has it been 10 years?
It has. It has been 10 years. We've been
my God.
2003. Wow. I know. So together for 17, but married for 10. So it's been a long time, and I met my husband in college. We were sophomores in college, and we met in the library. And ever since then, April 23rd, 2003, we've been together.
Nice. And what does he do for a living? I know all this stuff.
He's an attorney by training, but he works in communications.
Nice.
So he was in law school in DC. I was in medical school in DC too. So after college, we both took a year off together, and then we both went to DC together for graduate school, and then came up after we got married back to New York, where our family is now.
Awesome. Yes, they are the real life Huxtables. Living your best life says munching on chips ease my stress. Yes, but so is crunches on that mat. That will ease your.
You are hard on them, Shannon.
Look, I'm giving myself tough love too, because trust me, I just finished crunching on some chips. I need to be crunching on that.
There's so many people coming in with weight gain from COVID, and the whole lifestyle has changed, especially in the city. It's like people don't walk as much, they're not taking subways as much, they're using public, or I guess ride shares, or getting cars. So it really is like a battle to stay moving, to keep you moving, and anything that can motivate you. I know my mom does a lot of YouTube videos and stuff like that. Whatever it is to keep you moving, you got to do it. Because right now, we thought the quarantine was only going to be for 2 weeks. I know I did. I was like, okay, it's going to be for 2 weeks. We're going to get enough food for 2 weeks. And I was like, okay, it's about to be New Year's.
Exactly.
So any routine that you had that you thought you were going to jump right back into, this is the new normal. So you have to find what moves you, what motivates you in this new world right now.
Absolutely. Absolutely. And what steps are you and your staff doing? Because, again, you're a family woman. You come home, you have a husband, you have a beautiful daughter. We'll talk about her in a moment, my Bree. But, right now you're a frontline worker.
Yeah.
You're right in the line of fire, because you have to see these patients every day. So what are you doing and your staff doing to keep yourselves from catching this?
So I'm extra, and I wear a lot of masks, and I do not take off my mask until I get home. So I could be at work for 2 hours. I could be at work for 12 hours. And my mom hates when I say this, but I don't eat. I don't drink. I carb load before I go in. And then when I leave and get into my car, I take off my mask and I basically eat there. So keeping my mask on the entire time, making sure it's an N95 mask, making sure you cover your eyes too. That's super important, because we know it can get through your eyes, your nose, and your mouth. So I have goggles, I have a face shield, I have 2 masks on. And then that's what I look like from the time I walk into the hospital till the time I walk into my car. I disinfect, my keys. I disinfect my credit cards. I disinfect my hands. My clothes come off before I walk 2 steps into my door, and straight into my laundry, and take a shower and wash my hair. And I think it has changed the way we all practice medicine. It has changed how our patients come in to see us. Having to see your doctor face to face is a special relationship. Like your doctor should be the closest person you have to telling whatever you need to tell them to. So having that connection with my patient lost. My patient can't see me smiling. My patient can't see my concern. My patient can't see my emotion through my mask. And that has been the hardest hurdle for me. But we keep our patients safe by, again, following all of the guidelines that the hospital's giving us, the CDC is giving us to keep it safe. And patients need to also keep themselves safe too. Wear your mask the entire time you're in the hospital, getting your procedures or doing what you need to do, so that it works both ways, keeping each other safe.
Absolutely. Absolutely. So here's a question from Mickey Dixon. Dr. White, how do you balance work, marriage, and family life?
I pray a lot. First thing I do is I pray. I pray about the week. I pray about my day. I do have, and it's hard to do that now because I'm working from home as well. So I see patients at home. So I try to carve out stuff, and I try to, I guess, switch my clothes or do things that can kind of break up the day. So for example, I'm going to see patients and I'm going to dress up the way I would in the office. And then when I'm done seeing patients on video, I take off my office clothes just to kind of have that separation, because it's very hard right now when you're working from home and you have kids or you have a husband and you're trying to kind of mitigate all the stresses. But I do pray a lot. I do write a lot of things down. I write my to-do list. So I force myself on Sunday to look at my week and prioritize and I have categories: work to-dos, family to-dos, and me to-dos. And me to-dos have to be working out every single night, making sure I get enough water and getting enough sleep. And so once I'm good, everyone else is going to be good.
Absolutely. Absolutely. My favorite saying is you can't pour from an empty cup, meaning you have to be full enough to pour out a little bit to your family and your children and your work and whatever else you have going on in your life. So
yeah,
you have to take care of self first. That's why in airplanes, they always tell you to put your mask on first and then you put theirs on, because you have to focus on yourself first and then the next person. Hi, Samantha's Life. Welcome to the chat. Thank you so much for coming. Guys, don't forget to give it a thumbs up. It really helps us out and, you know, keeps the channel growing and growing. If you want to help in that category, you know what to do. Hit on that Cash App information below. Tap on that bell. Hit that like. And let's go. Here's another question. What do you do from getting depressed because of all that's going on in the world? Oh, that's a good one.
Again, I do have a very strong spiritual routine. And so I know that, you know, I have my Bible study at 6 o'clock tonight. So soon. I do church twice a week, and I do honestly look at the bigger picture and kind of keep my family close. I do have a close-knit circle, and so that when I do have times where I'm feeling low or I am feeling depressed, because nobody is immune to that. Right? Nobody's perfect, despite what you see. You have to have your support system. So keeping them close at hand. Not seeing my parents really made me very sad for a very long time, because I'm used to going there almost every other weekend to my family's house. So finding ways around it, going on Zoom, calling my siblings more often, and just kind of making sure that we know that this is a point in time, right? If you keep it in perspective, say this is a point in time. If we got over these things in the past, we just got to give ourselves time to get over this too. This is not insurmountable. We know that we can prevent these disease by social distancing, by keeping our masks on. We know what we need to do to keep it at bay. And if we all get on the same page, we're going to see the light at the end of the tunnel. But for now, it's keeping things close and keeping, my spiritual life at the forefront of it all.
Perfect. So while we have you, I have just one more question left. And that is, what you got in that makeup bag, girl?
Now, I wish this wasn't in the middle of a pandemic, because I had a lot more. But my go-to, I use Fenty Pro Filter a lot because of greasy spots and things like that. This has been immensely great. And I do use, so I toggle between Fenty and MAC a lot. So I do use a Studio Fix concealer, 24-hour concealer, before I put on Fenty. And then my go-to lippies would be Ruby Woo when I really want to get feisty during certain interviews. And I always put on a red lip when I see patients, because again, it's kind of like, I'm here, you can see me, especially with all the lighting issues with the phone. So, and then I really like Yash also from MAC.
Okay.
So I'm wearing Yash today.
Yeah.
And then I got this kind of, I don't even know what it's called. What is this? Like a Fenty, I guess, Girl Next Door and Chic Freak.
Yes, the highlighter duos. That one.
I really want to spicy things up, I can use this. But those are my go-tos, and see a nice mascara to go with it. So
there you go, and that's all you need. Remember, your face is half covered, so if you at least have your eyes going.
I'll makeup on that mask. No, I'm not doing it. This is for this reason I have makeup to talk to you all.
Okay, but so for your day-to-day, you just focus on your skincare. What kind of skincare products do you use?
I don't use a lot, because when I was growing up, I had really, really bad acne. So I used Proactive up until they changed their formula well into my 20s. And then, you know what, I've had enough. I'm not using anything on my face anymore. And so all I use is a Dove Sensitive Bar.
Okay.
That's it. And then I put a little bit of moisturizer on at night, and then I'm done. And then that has actually been really and increase my water and decrease my stress.
Yes.
That has been hands down, like,
absolutely. So before we let you go, you're also a mom. So I wonder her a shout out. How old is the lovely Brielle?
Brielle is 7, and she'll be 8 in January. So
she's in school. So, what are you guys doing with, what's going on with the schooling? Is she learning from Skype?
She's doing all. It's a struggle. I
know.
And I have to, teach her how to do math. She's doing online virtual learning for the entire semester. Hopefully spring is better. We can send her off to school, but we decided that for just simplicity and to keep her safe, because we didn't know how things were going to go, we are keeping her home, and she's doing everything virtually. She loves it. She loves being able to give me hugs in between her meetings. And so I don't know if I'm going to be able to get her back to school because she's so wanting to be but she's a blessing. She's my heart and soul, and she's doing really well. Thank God.
Yes, that's my girl right there. All right, well, that is it. Thank you so much, Dr. White. This has been a great talk. I hope you guys were as informed as I was. Thank you, Terry. He's just developing us women. Thank you so much.
Thank you. Thank you so much.
We appreciate it. Thank you so much for your time and your care. I think we touched on a lot today. And if I can impart one thing for the audience, what would you say?
I would say what I always say, colon cancer is treatable, preventable, treatable, and beatable. So preventing it, treating it, and beating it. And, getting screened, it should be at the top of everyone's to-do list for the new year.
Fabulous, fabulous. All right, guys, you know what I'm going to say next. You've been Bellafied. Thank you so much for coming. Take care, and I'll see you back here soon. Thank you, everyone.
Thank you.